All right, welcome back to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to raise the awareness of trauma and to support and inspire new trauma therapists just starting out on their trauma-informed journey. I do that with my membership community, Trauma Therapist 2.0, my online courses and workshops, and the Trauma Therapist newsletter. If you're a therapist of any kind and you work with individuals who've been impacted by trauma, I invite you to head on over to my website at thetraumatherapistproject.com. That's thetraumatherapistproject.com. All right, let's get started. Here we go. Recording. All right. 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I'm very excited to have as my guest today, Dr. Alice Kerby. Alice, welcome.
Thanks so much for having me.
All right. So Dr. Kerby specializes in somatic experiencing trauma therapy and recovery coaching. She holds a clinical doctorate in physical therapy and is an expert in movement and working with the nervous system and body to unwind past patterns of trauma and chronic stress. Dr. Alice helps her clients and students to gently touch into past trauma patterns that are stored in the body. This leads to restored resiliency in the nervous system, offering greater ability to make choices from a place of one's essential self. As a sober woman, she is passionate about bringing these tools to women in recovery to facilitate an engaged life that is hallmarked by ease. Awesome. Alice, before we get going here, share with the listeners where you're from originally and where you are currently.
Sure. So I grew up in Northern Virginia in a suburb of DC. That's where I was raised. And I've moved around a lot. I think I left home for the first time when I was about 20, did a bunch of traveling. And now I'm in San Diego, California. I've been here for the past 5 years. I'm like, is it 5 or 6? But I think this is the start of year 6 here in San Diego.
Awesome. All right. So 5, 4, 3, 2, 1. Okay. Awesome. All right. Let's get going here. So I'm really excited you're on, reading through your bio. You're obviously passionate about what you do. How did you get into this field? How were you pulled into it?
Sure. It's such a good question. And like many folks, my path to the work that I do has been very nonlinear. Even with going back to get my doctorate in PT, I didn't go to college until I was 30. So that was just a later in life decision. I was really ready to focus. I knew I was a massage therapist at the time. I wanted to expand my scope of practice. So I went through that whole rigmarole, spent most of my 30s in school and, came out with this doctorate, which was great. And, I love movement. I'm super passionate about getting people moving, but I've always been so interested in the nervous system and in the brain. And I actually have this on my website. There was a segment in school where we got to dissect brains in our lab. We had an amazing neuroscience teacher. And so we got to go in and look at these cross sections of the brain and see the corpus callosum. And it was this very spiritual experience for me, really, to be that close. And it's like this microcosm of the universe is what it felt like. And so, when I first went back to school to study medicine, I had the thought that I wanted to be able to combine it with working with some of these neurological patterns and working with the subconscious. And I didn't quite know what that would look like. Certainly wasn't a focus in, my Western medical education through PT school, but I knew that's really where my passion was. And so fast forward a few years later, getting my doctorate, I went through some bouts of pretty bad anxiety, which compounded an unhealthy relationship with alcohol. So I was really drinking in excess, trying to deal with the stress. And, I think as most of us know who go down that route, it's just not an effective methodology. So, around the time I decided that I really was seeing this as a problem, I really was very ready to change my life and get back to feeling good. I got into a recovery program for alcohol, but I also started seeing a therapist at that time, and just very magical. A woman, she lived up in my neighborhood, up the street from me here in San Diego. And it turns out she was a somatic experiencing practitioner. And so as I, stopped drinking, began getting sober, I had more awareness of my own body. And we started doing this somatic experiencing, or SE for short. And this work was amazing to me because I started feeling really good. in my body. And I think a lot of times when we think about recovery or when we talk about recovery, it comes with this sort of heaviness and this sense of like, oh, we've got to do this work and it's hard. And, it's really difficult to get through addiction with anything, food, alcohol, overwork, whatever it is, because those patterns do get very ingrained. But what happened for me, and I think really helped me to be quite successful in my recovery early on, was I had the experience of feeling really good in my body. I had the experience of being able to touch in, to my inner world and my inner realms and feel good and feel pleasure and feel delighted and feel connected. And I didn't want to lose that because the whole time I was drinking, and I think a lot of us experience this that go through alcohol addiction or some kind of separation from the self, it's that disconnect. And when we're able to come back and connect and find that home within ourselves, it's such a gift. So I worked with this therapist for a few more years. My sobriety was going well. And she said, you should go take this training. You really love this work. I think you're really good at it. So I went and I did just that. And I went through the 3-year training through Somatic Experiencing International, which is the institute where you can get certified for this work. And I just got certified to be an assistant. So I'll be hopefully assisting some of the trainings in May. I just reached out to the teacher yesterday. So
congratulations.
Thanks. Yeah, it's exciting.
When you first started working with that therapist and started working with the body, what was that like for you? Was that like initially what was your experience? Was it like, no, or what's a body? Like some of us.
Yeah. And I experience this with some of my clients now, where it's like that we bump into this edge of, I don't know if I'm doing this work right. And I don't know why I'm doing it. And I don't really like it. We're so cognitively focused in our society. And certainly after, 7 years in the Western medical indoctrination, machine of advanced education, I was pretty analytical. But honestly, I loved it. It feels really good for me to be in my body. It feels really good for me still to have a guide. I still see the same therapist, and I'll just go in there sometimes and be like, let's just help me be in my body. And because it's lovely to have someone help with that. So I don't remember it being too strange or weird. I mostly remember having those experiences of connection and of feeling good. That's really the highlight for me, is I can almost sense it now. This just kind of a sense of like a golden light and warmth in my body, which is so pleasant. It's wonderful to have that experience of, I feel good in myself.
What was it, Alice, initially that inspired you to, study physical therapy?
Sure. So I've always been really interested in medicine. I studied Chinese medicine and alternative medicine as a part of the massage program that I was in back in my 20s. And I've loved the body. I'm a mover. I love moving. I love different types of movement. I'm a dancer, or I was a dancer. I don't dance so much anymore. And it just made sense to me. When I was first going back to school, I wanted to be an osteopathic physician. I thought that was my track. And then as I got into it, I took the MCAT, I was applying to med schools, and I just really got a very strong sense that wasn't for me. And, if you're going down a path like that, I think you've really got to be 100% committed. So I did a little more digging. I actually looked into some neuroscience PhD programs, but PT made the most sense to me because as a clinician, I'm able to move, interact with my patients, but I'm not stuck. Like doing just straight research seemed very stagnant of the body for me, which wasn't appealing.
Okay, so you had this therapist, sounds like an incredible experience. It continues to be an incredible experience for you. How did things unfold such that you developed your own practice and working with, is it primarily women or exclusively women you work with?
Primarily women. I do have some male clients, but my niche is more women.
So how did you, go ahead.
Sure. I mean, I think from the time I first ever started working, I've been an entrepreneur, and I've always had my own practice of some kind, whether it was as a massage therapist or as a physical therapist. So I knew, like, looking at my priorities and my values in life, I love to travel. I want to have a certain amount of freedom in the world. I'm not married. I don't have kids. And this is by design because I like to be able to move freely in the world. And so I wanted to have work that I was passionate about, where I felt like I could make a difference, but where I could adapt it to my lifestyle. And So from the get-go, I really wanted to be able to do this work online, which is primarily how I work. I see clients via Zoom. I do see a few people in person when I'm in San Diego, but the bulk of my practice is online. And really, it just started with knowing that that was my end game. And I worked with a variety of business coaches to kind of help me with nuts and bolts of navigating, start creating an online business and things like social media and advertising and marketing and all of those things. But I really had a clear, and I still do, I hold a really clear vision of like my end game and how that ties to my purpose. And, I just take steps every day towards that.
What would you say is your kind of where your ability lies, where your focus, your passion lies, or what? Let me rephrase that. What allows you to do this work? You talked about being a dancer and loving movement. How would you articulate that?
I think because I've done the work myself, I continue to do the work myself, and I see the benefit and I feel the benefit. And to be able to help, I'm going to say other women here, but I'm certainly not excluding men. Just the bulk of my clients, as I said, are women, but to help other women to be able to come back to a place where they're able to like actually truly deeply relax. It's such a huge thing, and it sounds so simple. And one of my biggest things, which doesn't always translate or make sense to people, is to help people get back in their bodies. And so, what I mean by that is to really be present where we're moving through life, aware of how we feel inside, not just emotionally, but also on that sensation level, with a good idea of interoception, that ability to know what we're feeling as we're feeling it. And to be, connected with themselves and connected in the world and connected to others and connected with like nature and the planet, something I'm so passionate about too. So I don't know if that answers your question, but I think the reason that I can do this work is because I do this work. And so for me, getting to work with clients means I'm in the field and I have to be in my own body. And I love that about doing SE work because I can't be checked out.
Right.
And,
now, as a lot of us know, people, especially who've experienced interpersonal trauma, the body can be a minefield. How do you approach that? How do you approach working when that is the case with someone?
It's a great question because it's the case with a lot of people. Even if there hasn't been major trauma, but a lot of times there has been, or there's been some, sexual trauma or just inappropriate type relationship with the body or eating disorders, where the body has not been a safe place for people. And so I think first it's acknowledging that and understanding that. And just because I had a really wonderful experience early on of my own body, I know that's not everyone's experience. And one of the reasons I love SE so much is because one of the foundational principles of this work is the concept of titration and of moving slowly and of trying, one small thing and seeing how it affects the whole and just staying there. And also this idea of really building resources for people. And so that's where I like to start with anyone. If it's too much to be fully in your body, it's completely understandable, but maybe we can start with just noticing, what it's like for your hands to touch or to put a hand on your shoulder or on your chest. And is that okay to stay with that? Maybe just for a couple seconds in the beginning. And so we work really slowly when it's when the body hasn't been safe. That's not going to change overnight. So we start establishing, where is there some security or sense of safety for the person, and building those resources so that when we go to the part that's harder or more scary, or there's some terror there, we've got kind of a foundational like backbone of resources that they can rely on. So we don't just plunge headfirst into the difficult parts.
As soon as you said, I would like to help people just become like really relaxed. I felt that.
Yeah.
I felt like, wow, that sounds great. I'd love to experience that. And you said, well, it sounds kind of silly or what, but it does, but it's obviously not, right? I mean, the ability to do that is vital.
Yeah.
It's crucial.
It is, especially in the world we live in where, overwork is seen as a badge of honor almost. And,
right. Definitely.
I think that's been the bulk of my own work, really, is learning how to relax, because I was on such high alert, high strung, high achieving for so long. And for a lot of people, myself included, your worth becomes very tied to that.
Right.
And so it's like when you start to relax, your nervous system actually can kind of go into these high alerts of like, wait, I'm not safe. This isn't okay. If I relax, something bad will happen.
Was there an event or series of events that made you realize that? Because you kind of talked about, you know, those two different speeds in a sense, you know, being the high alert and Western, the MCAT, and
there comes some trauma just thinking about that.
What made you kind of shift your focus?
I mean, I had to, or I was going to die. Like I could, you know, I was medicating with alcohol because I was so you know, I couldn't sleep. I was taking sleeping pills. It wasn't working. And it got to a point where my life, you know, as a lot of alcoholics can relate to, just kind of crashed and burned, and watching people I love walk away. And it became very clear, like, I'm going to die if I keep living like this. So I didn't know at that time what I needed was this like total nervous system reset around being able to be fully relaxed and to be okay with that. But working with my therapist was very instrumental to start recognizing when I would come up against that pattern. And it came up a lot in building a business. I'd like to work more with entrepreneurs, actually, because I think this comes up for a lot of us. Of, you know, you feel like you've got to do things all the time because there's always things to do when you're doing every part of the business. And you know, when you're coming at it from that mindset of like, I have to do all this, and this is the speed with which I go, you burn out really quickly and you're miserable. And, you know, you can't really do work like this when you're miserable. It just doesn't, it doesn't work.
Can you share an early clinical error? I mean, it sounded like you came to this kind of later, right? You went to graduate school at 30, had some experience, but what was it like when you started as a therapist yourself, working within this context? What was it like early on for you?
With doing somatic experiencing work, you mean? Yeah, definitely. It's a little nerve-wracking, you know, because it is trauma therapy. And one of my first clients had some pretty, you know, she experienced the death of a child. She was in early recovery. So it's big time life stuff. And I'm a very compassionate person, and we had a good rapport. So that certainly helps a lot. And I don't know that, you know, I'm just thinking back to our early sessions. I actually was just in contact with her yesterday. I don't know that I made clinical errors, but I didn't trust as much as I do now after practicing for a few more years. And I'm sure 5 or 10 more years from now, it'll be even, you know, a whole different ballgame. Because with certain clients, I trust my own experience of the field and of what I'm feeling when I'm working with the person, and trust that even if things are kind of difficult, like if we're sort of bumping into stuff and I'm, you know, maybe trying something and it's not quite working, or the person's cut off or not receptive, now I'm able to really kind of lean back, check out what's going on in my own body, make sure I'm here, and then we try something else. And I just meet people where they are. And I'll say, like, you know, let's try this. If it doesn't work, well, we'll try something else.
Right. Yeah, that trust is crucial. I know when I first got out of graduate school, I didn't do that at all. You know, I mean, I don't want to say like a lot of people, but certainly for myself, you know, I felt like I had to prove something. I had to have all the answers. You've got this degree, you're studying, and this I'm going to try this technique and intervention, and it's got to work. And obviously we know where that goes.
Sometimes it does work and you feel really great. And, but I think so much of doing, you know, any of this work, even with PT on a different level, that clinical experience is just priceless. And the only way to get it's by making some mistakes and, you know, doing some more work.
I love what you're saying, Alice, about just, it sounds like you're really bringing your own experience, your own life experience into the work you're doing. And there's something so beautiful about that.
Yeah, I'd agree. I don't know how to practice any other way. And I think that's also not to say that I kind of bleed all over things or have poor boundaries, because I'm very professional in my clinical work and in all of my work. But yeah, I mean, my life influences and informs my work. And I just went through a pretty difficult 6-month period myself. And like, I'm kind of coming out, and I've talked just a little bit about it, but it's been going through things like that and having these tools and knowing how beneficial they are for me to move through those hard experiences. It helps me to be able to bring some of that to my clients as well.
So, talk about the sober girls. Do you want to pause there for a second?
Yeah.
Okay, we can pause.
Yeah. Hi. Can I help you? Mark's in the front office. It's okay. I'm in the middle of an interview. I was like, wait, did someone just walk in my office?
It was fun. It was like
that's the first time that's ever happened, guys.
That's funny. That's no worries. We could just cut that out. Okay. Okay, we'll start here. So 5, 4, 3, 2, 1. So one of the things that really interests me about you is, I mean, you said you started off the bat that you wanted to create an online business. So whereas during the pandemic, obviously a lot of people were shifting to online. Was that not the case for you? You were just business as usual?
Pretty much. It actually worked out. I mean, that's a silver lining for me personally with the pandemic, as more people got used to working online. But I'd already been building my practice for probably two years, a year and a half prior to the pandemic. And because I work with women all over the world, it makes more sense for me to do the online model.
Right. And in terms of creating your business, you said you wanted to maybe work with entrepreneurs, and were you talking about like coaching other people? Because I know I'm kind of focusing on this because I know a lot of people who are listening are interested in this. How do I do this? And you seem to be doing it.
I do seem to be doing it, huh? It's pretty great. Sure. I think, I would like to work with entrepreneurs around stress and around business. And I'm still in a building phase. My business certainly isn't, where I would love it to be with the end game. I'd like to have a bigger support team and do more public speaking and things like that. But I've certainly made a good bit of progress, and I like the practice I've established. But I think really it does come down to mindset. And I remember hearing that so much as doing these different coaching programs as an early entrepreneur and trying to find the answers. And I was like, my mindset's fine. Like, tell me all the secrets of business. And even recently I've come back around to like, no, I've got to spend that, 10 minutes of meditation in the morning. And I spend 3 minutes just kind of visualizing what I'd like my business to be like and feeling abundance in my body. And I got a good reminder from my coach because I needed it. And I'm like, oh yeah, that actually really helps and really works. And it's a simple thing. And of course there's strategies and tools. And I think it's always, great to have a business coach. But when you're in those patterns where you're so torn apart by trying to build your business, because I really was for the first couple of years, I think it was really difficult. So if you're in that kind of place, working with some of these like patterns that are stuck in your nervous system and identifying them as such can be really helpful. And I think that's work I'd like to pursue, is this kind of branch out and work with entrepreneurs as a subset, just because I've been through that experience and I know what it feels like to get through it and come out on the other side and to not have so much angst around trying to build your business.
What would you say, Alice, is your mission, your passion? Who do you want to work with? Who do you want to help?
Yeah, some of my favorite people to work with are like high performing women. And it is nice when they've been in recovery for a while, just because we have that in common, but that's certainly not only who I work with, but it's these women who are on super high alert, high stress paradigm, and they don't think that there's another way to live. And they've tried a bunch of stuff. They go to yoga, they listen to podcasts, they read the spiritual books, and they're just not at home in their bodies. And there's so much like stress undercurrent. When I work with those clients, we see such profound changes, and it's awesome. So I really like doing that because it's empowering of women, but in kind of a subtle way where we empower women to just be themselves, to be in their bodies, to have strength and power and relaxation and calm.
What is it that you're able to share with them that turns the light on for them, do you think?
I think it's tools over time. I think it's just beginning to come into the body more, to have more experiences when you do have that sense, like you were saying, you felt earlier of being relaxed, and to be able to stay with it and to recognize more and more when that happens, and to be able to stay with it more and more so that that becomes more the normal versus the other, the high stress thing. And so it's work over time. It's not like I have a magic wand. I mean, that would be really neat. I just reread all of Harry Potter. Yeah, but it's work over time. But I think anytime, and I'm giving this talk on Tuesday, it'll be it'll be a long time ago when this comes out. But that's one of the things in any of the talks I do that I always try to walk people through, even if it's this very brief experience of what does it feel like in your body when you can actually like relax or settle, or have a moment where you just like look out at a tree or something pleasant, and give yourself that time and space and let your system take it in to the point where it's okay for you to be in that state.
Right. Awesome. What is the best way for people to get in touch with you, Alice?
Sure. So people can reach out to me via my website, kirbymethodconsulting.com. I'm active on Facebook. I'm getting some TikTok stuff together. I'm also on Instagram and LinkedIn, but I think for the next couple of months, I'm going to be focusing more on Facebook and building this TikTok.
Okay. And you have a podcast?
I do have a podcast.
Okay.
It's called Beyond the Pink Cloud. We've been on hiatus, but I'm going to pick that back up in February. So it'll be the 4th year of the podcast. So we've got a lot of great interviews on there. Awesome.
All right. Well, we'll have this linked up here at the show notes page at the traumatherapistpodcast.com. Alice, awesome, man. I love, you just have this presence, and you can really feel that you're living what you're doing. And it's just inspiring.
Thanks so much. Yeah. Thanks for having me on to talk about it.
All right. Take care.
You too.
Thank you so much for listening and supporting this podcast. And if you'd like to join the hundreds of other therapists who are each month keeping up to date and informed and inspired about what's going on in the world of trauma, I'd love to invite you to head on over to the Trauma Therapist newsletter. That's the traumatherapistnewsletter.com.